Today we have three important items on the agenda. The first one being something that is the number one talk of the town, the world actually, in terms of the coronavirus. And we thought that it would be fitting to have someone from the Department of Health and Mental Health come and speak. And so today we are honored to have Pauline Ferrante. She's going to give us a brief presentation, I believe, about what we're doing here, what we're not doing here, how you can get help, how to avoid it, and all the rest of the stuff.
Sounds good. So good evening, everyone. As mentioned, my name is Pauline Ferrante from the New York City Health Department in the Office of External Affairs. So as a disclaimer, I am not a doctor or medical professional, but I'm here to speak to you about how the city agency is preparing for or has been preparing for novel coronavirus, which has been renamed by the CDC as COVID-19. So moving forward, I'll use COVID-19 because there are various strains of coronavirus and it gets very confusing. So COVID-19 is exactly what we're talking about with this strain that originated in Wuhan, China. So right now, the risk to New Yorkers is very low. Our preparation, though, is very high. We have an entire unit within the health department that focuses specifically on emergency response. And so their only goal and job on a regular basis is to prepare for situations like this. And so we are very ready with protocols and templates in place for the event that we actually get a case. So currently there are 0 cases of people with coronavirus in New York City. We did test 7 people. They're called persons under investigation. All of their tests have come back negative. So 6 of those people were New York City residents. 1 of those people was tested and treated in New York, but they're not a New York City resident. I know there were some questions about what's happening with the state. We do know what the state is doing, but we are a different entity from the state, and so we're focused on the 5 boroughs.
What's the test?
I'm sorry?
What test is used to?
Oh, so it's a test that's created by the CDC, and it's to test specifically for the
What is
COVID-19.
what is it though?
What do you mean?
Is it a blood test?
take
Do
blood.
they take air? What do they do?
It's a blood test.
Yeah.
Yeah, so
And how long does it take to determine if the person is infected?
typically it would take about 2 to 3 days to get a result.
Could I just ask you to clarify one thing you just said? Was you said one person wasn't from New York, was tested and treated in New
Yes,
York?
so they were
Treated-
here in New York, in New York
And they
City.
did have coronavirus?
No, they did not. So all
They were
7
treated, you said tested and treated, that's why I was confused.
Oh, I see. Okay, so they had symptoms, so they were ill,
Oh, okay.
but they did not have coronavirus.
Thank you,
Yeah.
that was the clarification.
What are the symptoms that might be different from flu or anything?
So they're very similar to flu. So it's a fever, a cough, shortness of breath, which makes it very confusing for some folks. And so the testing requirements for a coronavirus test or a COVID-19 test would be if you had traveled to Hubei province specifically, and you are exhibiting these symptoms. So that would indicate and trigger an actual COVID-19 test. If you haven't visited China or Hubei province specifically, there really isn't that risk of that you would be exposed to coronavirus or COVID-19, and so that test wouldn't be necessary. So a regular flu test would be probably administered to you.
For how long is someone under investigation?
So they're under investigation until their test comes back from the CDC. So what we do is the hospital will send the test kit sample to the CDC for them to do that testing, and then they will provide us with the results. So when
Are they in quarantine during that period, or is it?
I mean, it's up to the individual hospital protocol, but it would be, they would be in a secure environment.
The quarantine was usually 2 weeks, that's what it's been reported, 14
2
days,
weeks?
about 14 days.
But so I think there's confusion about, or there's talk about quarantine in the hospital. I think that's a regular standard
Right.
protocol.
I'm talking about over there, it's about 14 days, they're on the cruise ships and those type of things.
Okay.
Yeah, can we ask for clarification just on that point? You said they're clear until what their test results determine if they're clear or not, but there is no 14-day waiting period in addition?
So, I mean, it would depend again on their condition in the hospital and what the hospital protocol is for their particular ailment, if it's not coronavirus. So, I mean, I don't
if
think,
the test comes back negative,
right,
and
they might still be very sick and will have to be
No,
in the
no, no,
hospital.
no, that's not the
Okay.
question. Why do people have to be held on a ship for 14 days to see if they'll develop the virus, correct?
So that's what's called an incubation period. So
Okay.
people,
So can you test somebody, they come back negative because it's been 5 days, and then they would be positive at day 10?
Yes.
The incubation.
Possible, possible.
Yes.
no,
But-
so you're tested when you're exhibiting symptoms.
Okay, so if you're not
Right.
exhibiting symptoms, you're not.
So during the incubation period, you're not exhibiting symptoms, is that what you're saying?
Potentially.
Okay,
Yeah, I mean, there's a
okay.
lot to
It's
be
not
learned.
black or
but-
white. We want certain answers, but it's not black or white. It's
No, so right. So I think like with a lot of illnesses that begin with viruses, yes, there is an incubation period where you may be asymptomatic. We don't know specifically whether or not at that point in time you are able to transmit, right? So it's only when you are exhibiting symptoms and you have been to Hubei province where you would be where the hospital will then call for a test kit for you to test for coronavirus. Does that make sense?
Yes,
And I can't
understood.
speak for cruise ships. I can only speak to what the city is doing
Right.
for New York City residents.
How's it
So-
transmitted?
So it's transmitted through the air. If you cough, droplets. That's what they are thinking right now, just like the regular flu. That's how flu is transmitted. So, our protocol is for people to maintain good hygiene, consistently wash your hands for 20 seconds or more, and don't touch your face, and try to stay, if you're sick and not feeling well, stay home. And those are the precautions that we're telling everyone to take. It's standard, safety around flu season, and this flu season has been pretty bad. So, we really want folks to just not be so worried about coronavirus, but just really take good care of your health in general.
What about someone who was in China but then had several stops on the way and would not necessarily be red flagged as someone who was a higher risk
Are you asking,
traveler?
is there like a,
There are travel restrictions in place.
Yeah, what are they though? I mean, you can travel to several different countries, and that restriction might not be red flagged if your last
If you
destination
didn't travel
was
direct.
right was
Yeah.
from Canada, but you were in Europe, and then you were in Asia, and then you were in China, wherever, blah 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 blah. So how is that being handled?
It's a
So I
question
believe the
there.
federal government came down with a specific guideline for that. So if you are traveling, if you have traveled from Hubei province specifically, you are under a mandatory quarantine. If you have traveled in China, but not in Hubei province, you are under a self-monitoring situation where they ask you to stay home and self-monitor your symptoms for 2 weeks. So it really is,
So they ask you to stay home.
right? Yes. But I mean, just like anyone with a flu or with a cold, like, we would love for people to stay
What's the
home.
protocol for someone who tests positive and they don't want to be in quarantine? What measures are taken then?
If someone tests positive
Yes,
and they don't want to be in quarantine.
or isolated. What do you do?
I believe that it would be hospital protocol
Yeah,
to
you have
have
to.
them in.
So they can leave the
Yeah.
hospital if they want to.
I don't think that's the
No.
case.
Well, what mechanism will prevent them from leaving?
I mean, the hospital would have that protocol in place to have them
Well,
isolated.
that's right, typically,
No.
if people insist, you can sign yourself out of a hospital. Can you sign yourself out of a hospital if you have coronavirus?
I would think
I would think
not.
not. The same thing they did a few years ago.
Wait. Board members, please do not answer. The people who are here to answer the question. Answer that question, please.
I mean, it would be, yeah, I mean, it would be the hospital's protocol, but I don't believe that they would allow someone who has tested positive to
So
then
what is
be
that
into-
protocol that would prevent them from leaving the hospital?
They would be under quarantine in the hospital.
So they would, well, What if they got up and started walking out? How is that gonna stop? Who's gonna stop them?
Hospital staff.
I mean, you're talking about a very
Mariana.
particular
The other thing is that-
situation.
This
Health
happened,
department
this
doesn't oversee
happened,
Hospitals either.
this happened when they had that flu a few years ago.
The
The
bird
one
flu.
woman, we wanted to put her in protocols and in isolation, and she got the ACLU to sue, you can't keep me here, but there was a potential she could be sick. So what are you gonna do in these situations like that?
So again, it's really up to each individual hospital for their protocol. It's our,
So the city has no
CDC
jurisdiction in the
guidance.
state of an emergency of preventing someone from walking out into the public if they
Right,
don't want to.
because, I mean, people still have the ability to, we're not a dictatorship.
But it's a health emergency, it's a little
Right, so-
different.
Right, so
Right,
we
and
would work.
It's not a
with-
dictatorship,
No, I mean,
come on, that's a ridiculous analogy.
well, I mean, we can't
You know.
force people against their will.
But there is a
to
federal,
treatment.
like, state of
Yeah.
emergency with.
Yes,
in
that's
this
what I'm
regard,
talking
right?
about,
So I'm
what,
saying-
So
so
could they
each
not
hospital-
contact federal officials and say this
But
person's
that would
trying
be
to
the
leave the
hospital.
hospital?
what is
Oh,
the,
up to the
the
hospital.
city
Right,
has
yes.
the ability to declare a state of emergency in certain situations. Would they do that if people who are known to be sick want to go into the general population
Right,
to
so
be
if
able to
you
stop them from doing that?
Test positive, yes, the hospital will do everything that they have to do.
Not the hospital, what is the
It's the
city
hospital.
going to do?
But, yes.
Can I chime in, Mark?
Yeah, sure.
It's the CDC, the Center for Disease Control, and it's the Federal Department of Health, there's the United States Department of Health.
Right.
They are regulating that, and there are protocols and rules that each single hospital has to follow. So it's not just the city or the state. So they are all with the CDC, and actually just today, there are 14 passengers that they are against CDC's advice. They still want to come back. So there's this, I don't know, constitutional right or what, but this is what it is, and the CDC is trying to handle it.
Yeah, but that's the paradox. I mean, it's a state of
Yeah.
emergency of infecting
You can't-
hundreds of thousands of people, as opposed to the rights of a few people having to sit in quarantine for a couple of weeks. I mean, one outweighs the other, I think, in this particular case. And these is why they have state of emergency. So I'm still not getting a good answer.
Can
Well,
I tell you
It's
based on
getting
my
the truth.
experience? I spent decades working in
I'm
hospitals.
not getting a right answer.
Well, you're not
So
getting
it's
the one
not
you
the
want, but
one.
I'll tell you
It's
what.
not what I want,
the
it's what sounds dangerous to me.
Yes, I know.
What sounds dangerous.
She's a
That's
doctor.
what I know.
Oh.
That's what I know.
I would love to hear your experience.
People have the right to leave a hospital. If they have a protocol that says this is dangerous, either they have to notify somebody and they'll do that, government or otherwise. Otherwise, we go get a court injunction. Lawyers, judges still have the right, and they're the only ones that have the right to make somebody do something they don't want to do. So they would then go presumably to a court and say, this is in the best interest, this is the guidelines of the CDC. They would then get the injunction that then they wouldn't be sued if they forced the person.
Yeah, I was worried about to be sued, but in the state of emergency, it's different. You don't need the judge.
But also, if someone
You don't need the
is inflicted with coronavirus and presumably very ill, they would want to stay in the hospital and be treated. So, I mean, I think you're thinking about worst case scenario. I
What
don't
if,
think that it's necessary that like someone who has coronavirus is actively exhibiting symptoms and would just check themselves out of the hospital and not want to get better and want to infect everybody around them. It just doesn't
You don't
seem
know
like
how one's going to react. Everyone reacts differently.
Sure,
You know, so
sure,
it's just,
but I'm
you know,
thinking that someone who is sick and very
I
ill
wouldn't presume that.
would want to stay in the
I
hospital.
wouldn't
and get
presume that
treated
as
and
100%
get-
fact.
I never said
And all you
that.
need is
I'm
one.
just saying that
Mariana?
Yeah,
someone
well,
would
so
want to get
basically,
better.
the city is still working with the CDC and we're
Yes,
trying to
yes.
coordinate.
We get all
have
of
no
our
real
guidelines
actual
from-
cases, you know.
We have
uh,
zero
Right, we have
cases.
zero
Zero
cases.
cases,
Keep that
and
in.
I would imagine that, as Cora said, in terms of the CDC, the federal level, they have certain protocols,
Yeah.
and each hospital
Yeah.
has their own protocol to sort of, you know,
Absolutely.
there are
And we
incidences
help-
that have happened in the past where someone, you know, and hopefully we won't experience that this
Right.
time, you
Yeah.
know,
And
but at
prob-
this point, we're going to take it one step at a time.
Mariana?
Yes. Wait.
Oh, I'm sorry.
So, as a former.
Could you please introduce yourself, because
Ricky Wong, I'm with Howard Hughes Corporation, but as of last week, I was the Executive Director of Community Affairs at the New York City Health Department. So I'm going to chime in here from my experience. I've been at the Health Department for 5 years. One, I would probably be more worried about flu than I would be any exotic disease that you hear about. It just sounds scary because it is exotic. I've dealt with Legionnaires, I've dealt with Ebola, I've dealt with Zika, I've dealt with other ailments as well too. And one, the likelihood of being exposed to any of this is so much lower than you would be from flu. This past season in flu already, you already have 10,000 deaths and stuff, but it's not obviously being covered. There is a flu shot. The effectiveness is, the rates are low, but it's better to have some type of effectiveness than not. And just, for kind of like getting everybody back down to like, to reality is that, it is a really, really low risk, and, I would not be, as concerned about it as I would be the flu or the common cold. And a lot of folks, at the health department is that what we used to tell people is that you feel sick, go see a doctor. And a lot of people go to Dwayne Reed, self-medicate, they buy some NyQuil and stuff like that. And usually they wait until they get really bad before they go see a doctor.
And then that's the problem.
That shouldn't be the case. So.
But again, if you haven't traveled specifically to Hubei province and or the rest of China at this point in time, the risk of you getting novel coronavirus COVID-19 is very, very low. There hasn't been a lot of evidence of, of transmission among people just on a casual basis, right? So I think people are hearing a lot of scary stories either on the internet or on the news, and the news likes to put out stories that encourage people to read their articles. The health department puts out information for the safety and benefit of our citizens.
Mariana,
so what we're trying to say is to keep this level of just understanding that this is something that is not going to affect the everyday New Yorker. Does that make sense? We want to just keep everybody calm and really just share information in a timely manner so people feel like they understand what's happening, but also not to incite fear. Because we also are seeing a lot of stigma among certain populations, especially among the Asian American population, that this fear of this virus is now causing blatant racism. And so we really want to make sure that when we are talking about this virus in particular, we also talk about our anti-stigma language that we are incorporating into everything we do. This is a virus, this is not about a group of people, and we as the City Health Department are treating this as a virus and not targeting a specific demographic.
Does DOH have everything that you're distributing, or a website to send people to, or something?
Absolutely. So we have a website, nyc.gov/health, and we have a whole section on COVID-19, and we actually are going to be mailing out a Cover Your Cough poster and some other materials to all the community boards and every single elected official, city, state, federal, in New York City, just so they have this information at hand. But we do have up-to-date information on our website that you can check every single day if you're interested.
Well, will you have any of that information for next Tuesday for our full board meeting? Do you have any of the handouts?
I could probably get some for you,
If you can,
Sure.
we'd appreciate
And
that.
if you have them at your office, we could pick them up.
Okay. Yeah, they haven't been printed yet, but yeah, they are definitely in progress right now. Thank you.
To address a couple of Mark's fears, I remember, if you guys remember, a couple of years ago when there was a couple of aid workers that contracted Ebola that they had worked overseas, and they came back, and I remember one or two specific cases where they forced I think it was a woman aid worker, they forced her to be quarantined.
That was in New Jersey, I believe.
Okay, right, well, it's the same principle, and of course, if somebody wants to sue somebody, then that takes things in a different level, but in general...
It's very difficult to sue the federal government.
Right, but in general, like, what
Almost
happened with
impossible.
that she was forced to stay in quarantine for a certain period of time, and I would assume if it got like that, the same thing would happen.
Cora?
I want to echo to Pauline's mentioning the special target group being affected, and one of them is Chinatown. It's really like serious
They're losing a lot of business,
in
a lot of people.
Not just Chinatown, but many areas of it. So in light of that, oh, by the way, I'm Cora from Councilmember Chin's office. So in light of that, Councilmember is actually working with some city agencies and also with the city for the Human Rights Commission on organizing some events to address this xenophobia and other issues that's related to this coronavirus situation. So I'll come back to you once the date is set, and hopefully you guys will also support it, telling people to come and trying to have the dialogue to understand each other what's going on. Because every day is actually changing depending on what Chinese government is releasing the information, depending on the validity of the information, plus the United States Department versus CDC, they may not be in accord with the decisions, such as the one in Japan, the 14 passengers, they are against CDC's advice, but then the US State Department said, no, they can come back, there's no symptoms, but CDC disagreed with it. So then that's the federal government affecting the state and coming down to the city, we have limited power. But
Cora,
we need the community voice.
it turns out that while Japan usually is right on with most of these things, they made the big mistake because the ship turned out to be an incubator for more people that weren't. So,
and now it's 500 some cases. Then just back to the restriction, like in the case of Taiwan, they actually, like when the situation happened at the beginning, they do the restriction right away. If you are from China, thank you, not coming in. And they did the thing to protect themselves, and that's what happened.
If my colleagues agree, one of the things I would like to hear is, one, like, the source of the city health department, how you're getting your information. Is it just from CDC, or is it sort of like where the police department has people in different areas? I mean, you have multiple sources? And when we talk about cities or the city-states or like Singapore putting certain restrictions, does the Department of Health for the city have any, as part of the plan, a level of restrictions that go into place as it might be, for instance, in a terrorist situation? Or is that not the case and it's really going to be pushed over to the federal government?
So we do get guidance from the CDC and the WHO in particular for this case. And with regards to any other sort of restrictions or quarantine, if you want to call it, that's guidance from the federal government. So that's a regulation that we would have to follow if the federal government is putting that in place.
So the city Department of Health doesn't have its own sort of tiered plan?
I mean, we have
For certain
individual
illnesses, I'm sure,
plans.
but
No,
this is like
specifically for
on another
coronavirus.
level.
Right.
No, so I mean,
this is worldwide.
Yeah, right.
I'm talking about
so-
for New York City and coronavirus. Does this Department of Health have a tiered plan? Okay, we find 2 cases, we do X, Y, Z. We find 20 cases, we move this up a level.
I mean, there's always planning in that case in terms of working with the local hospitals, but again, because this is, the federal government is involved,
Right.
like they are
they're
providing
running the
that
show.
If you
guidance.
found cases though, wouldn't the federal government step in?
Oh,
Oh, yeah, I mean, they're already very
That's
involved
okay.
in
Okay, so that would
providing
be the
guidance for
answer.
every single state.
So if all of a sudden there's 10 cases and people start getting worried, this
They'd be
Department
on-
of, the City Department of
they'd be
Health
right here.
doesn't do anything, you turn it over to the federal, or
No, so
the
we
federal
receive
government will
guidance
give you.
from the federal
I know
government
that.
and will implement.
Okay, so
that.
you'll get your directions from the federal government, in other
Correct.
words.
So you know, all the hospitals in the United States of America, they are all under the federal government and the state.
Yeah.
Nursing home, healthcare, everything is actually under the oversight of the state, which is with the federal. The city doesn't operate on its own, and the city has to follow all the rules and protocols from CDC and from the federal down to the
Okay,
states.
I'm surprised that there isn't a city
Yeah, it's
plan.
complicated.
But, yeah,
Betty would understand it as well,
Okay.
for anyone who
I mean, we have a plan in place to be able to follow the guidelines provided. So it's not like we're not prepared to implement things that are going to be determined. So, it's not like we're just floating around waiting for guidance. Like, we're very actively preparing and working with the CDC and the WHO on what to do should something
right. And because it's just for what my
Right.
colleague
Sure.
had said, one of the things we see on the news is people in Wuhan being forcibly taken from their homes
Right.
by, people in moon suits,
Right.
screaming and kicking.
Right.
So I don't know if that's where you were going ultimately with that, but that,
So we'll take our last
That's a
2,
different form of
Diane and
government,
this
so
gentleman.
It has no bearing here.
It's a different
Well,
constitution,
different.
the Chinese government versus.
But
the
once again,
US.
our colleagues are answering,
I mean, I really think
in
it's just
a dire
a
health
level.
emergency,
The
We've
doctor
gotta move on
that
now.
sounded the alarm also died because they didn't believe him.
That's not the answer.
So
to
I
the
guess-
Guys,
No,
we
I
gotta
think,
move on.
I
No,
think
this is
what we need
ridiculous.
to clarify is just the level of
I know that.
concern at this point and the appropriate reaction.
I have
of
two
our
more
city
questions for you,
government.
and then we're gonna.
So right now, the risk is low, and so our reaction to that is appropriate, right? Like, should there be something to occur, I think then we would amp up our reaction. So right now, we're in preparation mode, we're very, very active in preparing should there be a case. But I think right now what we're trying to tell people is that, again, the risk is very low to New Yorkers. I understand that there is a fear because this is a new, novel coronavirus, right? And that the news is blowing this up to the point where people think that, like, you catch it and then you die. That's not the case. And so we really want to just be able to share information so people feel equipped.
We all know that, I think.
And, you know, that they feel safe going around doing their regular day-to-day business and not having to worry about contracting COVID-19, and also respecting your neighbor and not assuming that just because someone's Asian presenting, that they're, you know,
They
walking
have it.
around with the virus.
Okay.
So, you know, this is all just, we want people to just maintain a level of, you know, understanding and information, and we want to be able to share as much information as possible so people can remain calm.
Can I chime
Diane.
in for a commercial? There's a We Love Chinatown, We Love the Community. The campaign was rolled out last week. If you go to Chinatown, you will notice there's only like maybe 10-20% of the restaurant is filled. This is springtime, New Year banquet, usually it lasts till May. Cancel. If you know Jin Fong can host 100 tables, cancel. So if you're considering where to eat, don't know where to go, please support.
We have a fundraiser.
Okay.
And that tells you how people
Our thinking,
understand that
All right, we need to move
There's a lot of
on.
ignorant people
Diane.
not following.
in this country right now.
Sorry, Diane, go ahead.
That's what it is.
What's the is there a treatment protocol, and how, is it different from treating the flu, should a case arise?
Right, so it would be treating the symptoms. There's no specific, like, coronavirus or COVID-19 treatment. It would be, you know, it's called supportive treatment.
So it's not like you get it
working
and
out,
you're,
right,
there's
exactly.
no.
Right, but people do recover from it, so, yeah.
They said they're working
Sir.
on a cure, but they don't have it yet.
I'm Graham Bojang, most of you guys know me, but it's fine, and we all understand why the principal threat right now is one of social panic and things like that. We have to address that. The presumption, at least of your current protocols, is that China will contain it, much like they contained SARS, much like we contained Ebola in West Africa. If that assumption is false, then of course we can't quarantine China. It will get to places like Mexico and Africa, and then it will get here. And then you just have to contain, again, the social panic will just be that much more. But all my reading says that unlike SARS, China won't contain this, that it will get out. It will be like measles, something that simply spreads, right? And if
So, I mean, I think there are studies that show measles is far more contagious
Yes.
than novel
yes, then
or
this, then
COVID-19.
these sort of viruses.
Right, and so again, it really is just messaging of taking personal precaution. Again, if you are not feeling well, just in general, please stay home. But if you do take public transportation out and about, just wash your hands regularly, don't touch your face. You know, if people choose to wear masks, that's something that you can do. We don't recommend it because we don't find it to be very helpful, but if you choose to and that makes you feel better, by all means go ahead. But again, I want to reiterate that this
One
is
comment
not
to end.
something that we are going to, like, the average New Yorker is going to be
That's not a
exposed
question.
to at a rate where it's going to be, you know, catastrophic to New York.
And there's a vaccine for measles. Where is there's no vaccine?
Yes.
So,
There's a vaccine for
Good point.
polio too.
right, that's why we don't talk about polio.
So, I mean, the
All right, we
point
need
is,
to
I
move-
think, get your flu shot.
There's a lot of
Just
ignorant people in this
Take
country.
care of your own health, you know, monitor how you're feeling,
Someone's-
and really just take care of your fellow New Yorker. I think that's the biggest takeaway here is that, again, risk is very low, but we all want to maintain a healthy environment for all of our neighbors. And so, you know, wash your hands regularly, monitor your own health, and really just be kind to one another.
So,
Okay.
I mean,
Closing comment.
New York, you know, we're not in Oshkosh. We're in New York. It's an international city.
Sure.
People coming in and out from all over the world all the time. So it might be low risk, but it's not as low as, say, almost all the rest of the country.
Sure.
And then the reason why I'm so skeptical is that I remember 9/11, the air was safe, right? They told us the air was safe. And what was the reason for that? That was so 3 days later they can open up Wall Street, even though there was a completely separate backup headquarters they could have went to, but they wanted the image to show people going to work at Wall Street. So you know how much you want to trust your government in these kind of situations. And the other thing I'll just say is my own comment is like when you have a health emergency like this or a potential health emergency like this. If the overwhelming concern of political correctness should not be an issue. It's just a health emergency, and that's the end of it. That's all I have to
I
say.
think we are seeing, though,
That's all I have to say.
active signs of xenophobia, racist behavior.
Worry about the health emergency. That's
All
your
right,
job.
All right, we're gonna move on.
That's your job,
Maybe
not
you
not
just-
not
one
anything
last
else.
I was just meeting with
No,
anybody.
that's not right, I'm sorry, that's not right, Mark.
We're gonna move
Those things are
on.
not mentioned.
Mitch,
Thank
we're moving
you,
on.
Pauline.
Lovely
Thank
talking
you.
to
But I'm
you all.
defending her
If you
because
need
that's
more
bullshit.
information, I'm more than
Moving on.
happy to
No,
provide
thank you
it.
very much.
I'll send you information for your
And, we'll get that
Yeah,
information,
absolutely.
and
They told her she's on the road.
Yes.
we'll also coordinate with Councilmember Chin's office if we have another, she's gonna do an event,
Yes, sounds
you
great.
know, and if this blows up, I know where to find
We
you.
are prepared. We are prepared. The risk is low, but our preparation is high.
Okay,
so
all right,
I
thank you very much for
understand.
coming.
Thank you so much.
Good.
Good night.
Thank you, good to see you.
Good to see you.
Okay, so, I know, you're
Yes,
gonna
ma'am.
tell us that everything is finished,
Almost.
right? Right, everybody? It's all done. We're getting close. We don't have to worry about it.
Yes. Some things are getting closer. So, hi, John DeLucia, BBC.
And you've had no snow.
No, we actually got some production this year. Yeah, we got, the oil static is done, but I said that last time. So we're working on the steam right now and gas. But anyway, I'll go through the blocks.
And you haven't heard from Bruce?
No, I haven't ever pushed, but, and that light, we told them that we could take out that middle light, but, Con Edison's not here, so I wanted, we've been trying to get them to disconnect.
Oh, they haven't done it yet?
They haven't disconnected yet.
Okay, will you stay on?
Yes.
Okay, great, thank you.
So anyway, again, this whole project, we're anticipating completion April 2021, sorry. 2021, a year and a half, a couple of months from now. The two locations that we're gonna extend to that is the Church Street intersection and the Park Road intersection. Everything up to those two intersections, we're gonna try to pave by July. So, I need Con Edison's help to finish some feeders here, and then we can finish the roadway at West Broadway. We can make that, if we can get that intersection completed, concrete base.
Which intersection is that?
West Broadway. So we could actually pave up to maybe halfway up the block, leaving the intersection. We have to keep this intersection clear. And this is, so we have all this water main in, and we have the water main in here, so we don't have this piece yet, which we need. So we moved the oilostatic, we have to move the steam and the gas, and that's what we're working on next.
And have you had any complaints from any residents?
Liz?
Liz,
With
where are you?
respect to the steam and the gas, or with respect to quality of life?
Throw it all
Yeah,
together.
so, I mean, my biggest complaint has been rats everywhere.
That was the rat lane, she just left. Pauline.
Can we chase it down?
Ironically, I spoke with Leah Flax from New York City Transit because,
Oh, let me interrupt you. Is this the one, this is the issue with that not
111
used subway?
Right.
Yeah.
So, she called me back. She called me back this afternoon. I left her a message because I felt I didn't want it to be like a stream of just emails. I said this, you said that. So I phoned her, she wasn't there, she called me back. So what she left me with was, well, they've plated it over and she will not be able to do much based on, she would have to get a letter from someone saying that that's where they're coming from. And as I said to, you know,
I thought she had to get a letter from the
isn't
building.
but I'm saying, but the building, the building can, you know, she can get, I don't know who she's gonna get the letter from, because as I said to her, the guy who does the baking for us has amped up the baking. We can only bake in the trench. Right? The baking in the trenches, they're baiting, the building itself is also baiting, and they've amped up their baiting. As I said, the dead rats that we see and smell is clearly that it's working.
Right.
But at the same token, and you know, someone even mentioned that cars are running over rats. Well, they're drunk with the poison, and of course, if a car is coming, by the time he sees the rat, it's
too
late.
late,
But I don't think from what she said to me, I get the impression that they're not going to bait unless someone can give them a letter.
Because
to say that that's where they're coming
because is it a letter to say that's where they're coming from, or is it a letter to say that they give permission for?
No. She's looking for a letter saying that that's where they're coming from, or that's where they are, in order for them to do something in terms of baiting.
So is she going to pursue it?
She's not going to pursue it. She's looking for a letter from me.
Oh.
And I know that the subcontractor who does the baiting can't say that because he's dealing with the trench.
Right.
Now, the only good thing that I have in the mix is that I know Starbucks in particular places their trash onward, so now we have a nice, great food source. So they put these buckets out there overnight, So, you know, basically they can have their smorgasbord of.
Is it possible to? I'm sorry. This may not be in your, area. Is it possible to get Starbucks to not leave their trash out overnight?
Well, this is where I'm going now. So basically, they're claiming that the sanitation wants them to put it there. First of all, it's private cutting. I don't believe that. The guy I usually deal with from sanitation is not back till Monday.
Okay.
So on Monday, I will be speaking with him because I'm sure if I bring this up as an issue, I don't think he'll have a problem with them, placing it probably closer to Catherine Lane, or, just so that, we see. And that in itself might even help because, she said to me too that, well, I think it's the food source. So because it's the food source, rats will, and that's true, rats will go wherever there's food.
Oh, sure.
So, it's twofold,
And they're
but
smart.
at the same time, we see rats in subways. They love that whole, it's a great enclave for them,
Yeah.
basically. But that's my biggest issue, rats.
Is
And
it a good
aside
area
from
for the
that-
dry ice stuff? I was just thinking about the dry ice, but it's exposed to people.
Yeah. And the other thing is, even as we bait more, there's a trickle-down effect. So if a bird eats a rat, that is poison.
Right.
Yeah, that was the
So,
question
so
I wanted to
there's
ask.
so much you can do.
Can I ask that? Yeah, because I have the concern,
Mhm.
like, up the food chain, it's killing other animals.
Yes,
What else can you do to prevent this? I know some hawks died in Central Park from eating poison rats. So, what can be done differently to contain these rats and not kill all the other animals?
I wish I could answer that question because what you get is the community complaining, you try to bait more without, like you say, doing an overkill. And at the same token, the answer to the problem really is in the way we dispose of garbage and the way we have garbage. out
Setting
of
out
the
Can you talk to, what is there, a subcontractor doing this? So,
The subcontractor, there is a subcontractor who's baiting, yes. What would you like him to do, not bait as much?
well, are there other less toxic procedures that you can get back to us on? Ask him.
The baiting
Probably
is
won't kill 'em.
contained.
What about the dry ice thing
It's
that
not
they
in
did?
the open.
Yeah.
But
Mariam
How long are you
just
worried
said
about
it's
the
open.
No, so they
It's open. Just
take
put
the
a plate
bait,
over it, it's open to the
then they're not immediately dead, they go and they go to the park or wherever. And then they're eaten by other animals, birds and whatever, squirrel, whatever the case might nibble on it, and then they all die.
Yeah.
So, that's something that.
Tell them where
But
the
how can we
location
do
is
something
though.
less
So
toxic, then it won't kill the rats?
what other procedures are available that you can find out for them to do?
Well, I will have to find out.
Because I know that the other cities have used this, have used other procedures that I know about, but.
There are other procedures, I don't know if it's conducive to the trenches we have, but I can find out.
Tell them
I'm not
where,
gonna
tell
you
them where it's
that I won't.
located, Liz.
I will. The particular areas
Thanks.
in question are
So you follow up on that?
Lafayette, Word Street
Thanks.
area,
You bet.
and there's been some issues at the Broadway, Word Street area. But if you look at those two areas, it's a it's the places where they have the most restaurants
Right,
and
exactly,
food
yeah,
sources.
yeah.
It's definitely Broadway and Worth. I see
Yes,
that, I
that's
see
what
that
I'm
all
saying,
the time.
it's Broadway and Worth, and it's Lafayette and Worth.
I mean, which
And those are the
takes us back to
places.
trying to
Yeah.
get, going back to our sanitation
Yeah.
issue, which is to try to get people, the businesses to not leave their
Because
garbage
some
out
of those
overnight.
businesses, like, I wish the businesses close and then
They leave their garbage.
there's, so either get the sanitation to come earlier, but if you
But
can't,
it's private
But it's also,
carting.
it's private carting,
Okay.
but that we could probably,
That
like,
needs to be raised.
once I speak with the sanitation guy in terms of moving the garbage, it's something that can be enforced through BIC
Right,
for private carting.
exactly.
So that either, we can ask these people in the interim to please pick up the garbage sooner or something like that.
Because I thought
So-
that they were supposed to arrange a pickup and put the garbage out according to their pickup.
When, as you say, when Big Brother isn't looking.
Right,
people
they just do what they want.
So the Starbucks we're talking about is the one specifically on the corner of Worth
Lafayette
and
and Worth.
Lafayette and Worth.
Right, and then with Broadway, it's so many different things there. So it's
Right.
no one business, it's every business.
and there's the big construction on the corner of Broadway and Worth feeds into that.
Yeah,
Yeah.
They've been digging up that street for a long time.
Anytime you start digging, they come running. So let's get on so that
right.
they can all get out.
Right, and so basically, we want to pave, again, complete all this up to about halfway up the church, and then pretty much pave everything from about halfway up this block.
Which is what block?
This is church, so we're skipping church, we're jumping over, so, and I want to pave all the way.
That was always the plan, right? To skip
Yes,
over church.
and pave all the way up to, say, Baxter at some point.
Pave
So,
up to Baxter.
we had good progress on Broadway, we got good progress on Lafayette, Center. I think Lafayette and Center, all the underground is pretty much done.
Yes, it's done.
Yeah, so it's
So-
just us putting the concrete base in the warmer weather, and then we'll have that ready for
So if
paving.
paving up to Baxter would be finished by when?
We're looking for July.
Okay.
Now, I need Con Edison to replace 2 feet, and that's why I was hoping they were there, and we could
Yeah,
pressure
'cause you
them
said
into,
that there.
at Westport, where they have 2 feeders, and I don't wanna pave this piecemeal, so
Right.
so I need that, it's gonna hold up the chain.
Right.
So, we're pressuring them, we gave them order outs, we've done what we.
They have to remove 2 feeders?
Yeah, they're high,
Mm-hmm.
so we put in, the contractor puts in 2 conduits for them to use that are lower. They have to come up with their crews to put the new cable in, remove the old one.
Can we send a letter to Con Edison, get the detail on what they need to do, just to nudge them?
Would it be helpful if we,
Yes,
if we
anything,
stepped in?
yes, that's why I like to bring this stuff up here, so we can get some peer pressure on them
Diana, do you need any information?
Follow up with Con Ed for what specifically?
West Broadway, lowering of,
West Broadway and Worth to
electric
remove
feeders.
2
Yeah.
feeders. To speed up working with DDC to get the 2 feeders.
Not to hold up
Yeah.
paving.
Right.
Sure, yeah.
Broadway, we're good, I think.
Yeah.
Yeah, I think the other intersection we're good, I mean,
This is the main intersection that is preventing us.
Church and.
So if you think that's done by Con Edison, you can have Watt paved by July.
Everything except church.
so, yeah, we're
So,
gonna
there-
leave,
go ahead.
we're gonna leave this out of church.
Yeah,
We're
okay,
gonna
okay.
box this out,
Okay, understood.
and then we're gonna pave everything down.
So everything
Yes,
west,
to Hudson.
so then it'll be back 2 ways?
It'll be 2 ways on
And
this block.
pave curb to curb?
Yes, curb to curb,
Right.
everything will be done, this block will be open 2 ways.
That's Hudson?
Yeah, these 2 blocks, we're gonna have to leave 1 way,
Right, yeah, yeah.
because of the intersection.
Right, yeah.
So once you get Hudson, so hopefully by February, by July, I'm sorry,
Yes.
you will have Hudson to Baxter paved.
Now, last time I was here, I wanted to pave by the spring, so those 2 feet have been holding us up, that's why I'm pushing it.
Oh, so how long have they been holding you up?
When we were asking them to come out and do this, they gave us 4 months to get this done. Now, this is 2 weeks worth of work for them, but for them to schedule, it'll take 4 months.
Can we
So,
write that in
I
our
need
letter?
a better
that it's-
schedule from them.
So how long have they been holding you up?
Since we came back in January at this location. 'Cause
So you've been on hold since January
For these 2
for a
feet.
2-week project?
Yes.
Oh, thanks.
Okay, so.
No, for them to get.
Maybe we should do a
the
resolution.
feet, 2 weeks.
Yeah,
Yeah, right.
that's what I'm saying, you've been
More
on hold
serious than I
since
thought.
January
Yes.
for their 2-week project.
And at a
Don't
progress
they
meeting,
usually
they
come
said
to these?
it'll take
Yeah,
several
Yeah, they
months.
come.
So what it is, they put it in the schedule. Right, and it just goes on that schedule, and if something happens somewhere else in the city, that crew gets pulled out.
And there's another new building going up, but we never generate money.
They have other
Oh, yeah,
priorities,
right?
yeah, this is.
Is that enough information for you then?
It sounds like enough.
Okay.
I mean,
Who are we
it's a pretty
addressing it to?
clear issue.
Con Ed, should we, with John Masiello?
John Masiello is,
He's the guy, he's the
What
field
is this,
representative.
inspector?
He's the one that comes up here and stands usually with me.
Okay.
So, if you need
But
his
I think they
contact.
should also send a copy to the, like the community affairs people, because
Yes,
like a-
I forgot her name. but we can
Community
talk.
affairs people at Con Ed.
yeah, I
Yes,
think they
okay.
should get.
She usually comes to this meeting, I can't think of her name.
Not Stephanie.
John Leo?
Uh,
John Leo is.
Stephanie.
John Leo.
Yes.
The one that sends out the notification?
Yes.
Yes, Stephanie.
John Leo.
Stephanie Bello.
Yeah.
No,
yeah,
Stephanie
exactly.
left.
Yeah, Stephanie
So
left.
John Leo is back.
Oh.
They
John
have
Leo.
hired a new person.
Oh.
John Leo, the regional manager, has been
Because I hadn't seen
chaperoning
any
the
emails from
process.
Stephanie for a while.
So he's going to introduce the
Yes.
new person for CB1. in the
Okay,
next
so
meeting.
John Leo's our new person, our new community person.
He's the interim person. They just hired someone new that they're training who's going to be integrated next
Okay,
month.
so I won't even bother to write his name
We
down.
want one
I have it. I know who it is.
We want to train.
You can tell him what to do.
Yes.
Leave him untrained so you can boss him around. So that's that, and then after
Basically,
you.
it is. Well, I mean, we're doing pretty well here. It's mostly contractor now working the same. Once the contractor work, it's fine. We can control that with it. It's when we need Con Edison to bring in the
Right.
crews, that's when we.
So once you get it paved and you go back to the Church Street intersection, what has to be completed there?
So Church, we did the orthostatic, we replaced that, we have to relocate the steam, which they're working on now, which is, it's a big deal. We're not gonna be doing that now because of the weather, so we have to wait for, probably in the spring we can do that. We have to relocate the gas, and then we'll have the lane for the trunk water main. So then we connect this piece of the trunk water main. Do we have any distribution water main left?
No.
No.
So it's just the trunk water main. Once we get the trunk water main, and then we start putting the road back together. We start piecing everything back. The steam will be in the right place, gas will be in the right place, trunk water main is, and then we start building the road back.
All right, so you know I never asked for like a definite, but give me an approximation.
I want this done by April 2021,
2021.
which is the end date of this contract, which we will finish on time. It was a 5-year contract.
Is there any more Con Ed work other than we just discussed that needs to be done?
Good idea.
Not really, on the
Okay.
Lafayette, now, we
No.
haven't started, we just started the Park Road. So once we
So lay that to the letter.
Yeah, because it's
whatever-
good, Mark, good
yes.
idea.
Right.
Because I asked
You
them.
know there's gonna be something in Park
Yeah.
Road that we.
Park Row, okay,
Yeah.
all right.
So that's the other part, we just started excavating into Park Road, we got the permits.
But I think the clause should be something like, you know, that they should be.
Future,
yeah,
timely,
Exactly. working with-
deadline,
Exactly.
To pave this by the summer, we can open a lot of these blocks, we can have that, and all those buses that are coming down towards Center have to go up to Leonard, to go
Right.
down
Mhm.
Lafayette.
Right.
They can make that left then, we can open that block.
Good,
Yes.
nice. People will be happy. Mitch?
I just have a general question. You said a 5-year contract. Are there any incentives in these contracts?
We had a 3-year incentive, but we blew right past that.
So between 3 and 5 years, like if they don't get to 3 years, then there's no incentive for them to finish before 5 years?
So the contractor lost his incentive, but it was all Con Edison delay, so they're gonna go after Con Edison.
Good.
Okay.
Doesn't do us any good.
No, it
Good,
doesn't.
good.
Have
But I don't know why they don't, like, if, you know, okay, they don't make the 3-year incentive, so they don't get as much for that, but then why go like all or nothing? Why can't there be incentive then if you do it in 4 years, like some, like?
Well, I guess you'll have to ask.
No, I'm
the
just wondering if-
negotiating team.
This particular project was bid in a certain way, it was called A+B bidding. They bid on A, the amount, which is usually the only case.
Right.
The B part of it was schedule. So they could have had a little higher amount than the next contractor, but had a shorter schedule.
Right.
So they came in with a 3-year schedule for the incentive, and a dollar amount of like $90 million. The second contractor could have had $88 million with a 4-year schedule. You put the A+B together, they became the low bidder. So their plan was to finish this in 3 years.
Right, I'm just always interested in the process,
Right.
how things could be done better in the future, not
Right.
specifically you or, you know, this one.
So their contention is if it wasn't as
Or Con
Con
Ed.
Ed, they would have been done in
So
3
they're
years.
gonna price them, yeah.
Right, so we
And
should
so
think
you're not
about
gonna
that
be
for the
involved
future.
in their,
Yeah.
and when they go after Con Ed, that has nothing to do with you, right?
No, we go after Con Ed too. We also hit them for, we
So
give,
do you ever get satisfaction?
some projects we do. So we hit them up for damages for delays. I
So-
end of the project though, I mean, that's years from now.
Right, but as a committee and as a community board, is there anything that we can do to bring Con Ed's, the problem seems to be Con Ed, so who should we bring this, to whom's attention should we bring this?
As high up as you guys can go, I mean, I don't
So
know.
maybe
what
that's
the-
right, there should be
yeah.
resolution instead of letter.
And they just raised
I'm
the
kind
rates
of
too.
thinking resolution after all this.
But we need to take it higher.
Well,
Yeah.
the Public Service Commission and
Yeah.
state legislatures,
Right, so
legislators.
let's think about that,
You know,
because
who
it's,
regulate that.
the only people who really get inconvenience are the community residents, the
Yeah, yeah.
residents.
I mean, this could have been
And the
done 2 years
businesses.
ago,
And the
really, if not for Con Ed. They'll probably come with some BS excuse. Well, we had emergency year, we had this, it was cold last winter, there's a lot of electricity, they'll be whatever, blah,
But
blah,
they
blah.
have to have contingency,
But-
well, we can discuss
but
it
to
later.
delay the
It's a year
project.
and a half to get the old status.
Pat, I just saw it in the
Yeah,
newspaper, I
so
think they put in
recall.
for a rate increase.
I've been talking about
They put in for a rate
this,
increase recently in the newspaper I just read.
Yeah, again,
All right, let's discuss this later, let's let you, if you're
Okay,
done.
so I don't know if.
Any Warren Street updates?
So Warren Street, Warren Street is, we're looking to pave by June, I think.
This year.
Yes.
This year?
Again, I need kind of.
2059.
April 22.
No, next June.
So pretty much, West Broadway, Deshaun, correct me if I'm wrong, we pretty much have everything underground done up to Church intersection.
Yes.
Church intersection, we have, if I remember, any kind of left on that?
No, only
Okay, gas
concrete
and-
base to be done.
Only the concrete
Concrete
basin,
base,
so the only thing we have remaining for Con Ed, and we've been pushing them on this too, they had a high gas service to a building and 2 high electric service to the building, which means it's high, it was in the concrete base. So
You mean high in the elevation?
high in elevation.
It
So
wasn't
we got the top of
underground,
curb, we
you're
got a 7-inch reveal, and then we got 3-inch asphalt, 9-inch concrete base. They're supposed to be below that. So they were in the concrete base, which is dangerous, especially for the gas.
How did that happen?
Why would they want to do that?
If they know they're not supposed to be there.
There's no women working there.
And I always
What
say
before
this,
the con?
when Con Ed comes out to do work, and it's on their monitor, they're gonna find the easiest lane, the fastest way to install something. So they usually go in the concrete base, they find the lane, everything goes on
But
top.
then it just means they have to come back out
Well,
again.
they think about that down the road. So now we come along and we wanna put in a proper
Let me,
roadway.
before I,
Right.
is it dangerous? Is it dangerous to
I
human
would think
beings?
Yes. Well, it's dangerous in the fact that if somebody comes in behind us and we have a high concrete, gas, and they saw cut the roadway, they'll saw cut through it. We-
Could that cause an
any
explosion?
contractor- What?
Could it cause an explosion?
A service is, a main would be a lot worse. I don't think with a service it would cause.
So
that.
power
But I could be wrong.
outage, what happens?
It would pretty much knock out that building.
Oh.
But either way, you don't want that.
Right.
So right now they're lowering the gas.
And gas work is complete.
The gas work is
Yesterday
complete.
they finished.
So on top of that gas, they had 2 electric feeders. So the gas dropped down. We're dropping the 2 electric
Yes.
feeders. So they're dropping down. There's 2 electric services going into that same building that's hot. So we're
They say it will take another 3-4 weeks. So we need the same later for Warren and John also, for Con Ed to
relocate those 2 electric services. If so that's on the north side. So pretty much we have the north side complete except for that one area. Once we finish that, we're gonna pour the concrete base on that and flip to the south side. And hopefully we don't run into any kind of some
As long
problems
as
there.
it's right.
Right. But realistically, I mean, we're done with the intersection, which is usually all the problems. Once you come to the barn, I think we have a good shot of pouring the concrete base on the south side and then paving by June.
South side only.
No, the whole thing.
Yay.
Yeah.
Paving by
Yeah,
June.
Right, yeah, and that's all this, everything in red will be paved.
Great.
Is that you guys on,
Okay.
what street? South Street?
No.
No.
She said no!
No, it isn't us.
South Street.
What is going on down there?
EDC?
Yeah,
No,
we see the,
Parks is on Peck Slip. They're doing the park at Peck Slip.
So maybe it's a couple of agencies, 'cause it's not your fault
I'm
then.
not on South.
But what they have going on there is you come down that, I guess that would be Frankfurt probably.
Driving.
Driving down to south, to the service road, the FTR. you have to turn. They force you to make a right because they have the end of the block closed at South Street, but there's no sign saying like do not enter, go a different way, or whatever. So you get stuck in there. Then you have to make a right, and then you can't make another one. There's a no right turn. So you end up going in a circle because of the peck slip little park thing.
Are you
But
trying to get on the south, are you trying to get on the east?
You can't get to South Street.
You can't make a
You can't get to South
You
Street.
can't make a left.
Once you start down that block, Peck Slip is involved because that little, between the construction, between the construction that's happening there and the little school, they close it.
Right.
So you can't go straight and you can't make a left, so you have to go back around in the circle and you're stuck.
So let's let them go and let's talk to.
I'll reach out to the Parks Department.
They're finally building that Peck Slip Park. I
Yeah.
don't know if you saw the presentation before. I know they used to, at one time they were gonna put like a ship in there or something like that.
Not anymore.
Well, they had some designs.
Yeah.
There's a restaurant.
Scaled back.
All right, so we have John Street with you though, right?
Yes, this is John Street.
Yeah.
So John Street's a lot better, where we have Con Ed, what again? I forget.
Con Ed issue between Dutch and Vegas.
Oh no, Con Ed again?
Feeder issue, one feeder.
So where is the feeder?
Change that to the left.
It's right here.
Still not
So,
scheduled from.
the first block is done, where we pretty much got the north side complete on,
Yes.
yeah.
On between.
So we're a lot closer on, John Street than we are.
So where's the feeder on that
Yeah,
one?
where's the
It's, I
feeder?
think they're right here, they're closer to Williams.
So between
Dutch
William
and
and Dutch,
William?
Yeah.
Dutch
Yes,
and
we
So
William.
can
then we could add that to the left.
Yeah.
You want answers?
Oh, you fey.
So if they came along and did it next week,
Yeah, we'll be in great shape. We could actually, I think July is, I'm
Is-
giving them some time to do those feeders.
so you
on
think
West
July
Broadway.
would be the,
If they came and got this done in
Paved.
February, beginning of March, yeah, we can, I think we probably have like a month and a half to 2 months of work at West Broadway, just to finish up the curb, sidewalk, concrete.
when does
base.
the weather start to get good so you can pave?
Probably around April 1st. week.
So if you hadn't run into this, you could plan to be finished by May of 2020?
Yeah, I think I was hoping before Memorial Day would have that all paved, but now,
Now it's July.
yeah, that's what I said. If
July
Congress comes out-
2020, given Con Ed does the feeder.
Right.
Yes.
Got it, right.
But if Diane writes an effective letter, it'll go a lot faster.
A strongly worded letter.
We need to get some other people behind the letter.
Follow it up with a
Yeah.
business and what for.
Yeah.
All
right, so that's it.
Two big projects.
Get some rats down
Frankie's
there.
here for the Front Street project. He's the engineer in charge for that project.
How's life?
Good.
Good?
We're looking to mobilize either next week or the following week.
I'm sorry, I didn't hear.
We're looking to mobilize either next week or the following week.
So front hasn't started yet?
No.
Okay.
Oh, so you think you're gonna start front next week or the following week?
Starting from Old Slip.
From Old Slip, okay.
What's that project again entail? Remind me.
It's a road reconstruction.
Oh, just repaving? So no,
Yeah.
Starting from Peck
Catch basin.
Old
and
Slip,
pads,
Old
the-
How much water main? Is there water main? No water main.
so no utilities, water mains or anything, just,
Water main's the big problem when we
Yeah,
have
there's no water
utility
main.
appliances, so.
So when you come back next time, you will have started, so you'll let
how
us
long
know.
is that projected?
2.5 years.
Oh, is that?
2.5 years?
For paving?
Yes.
Well,
Why, this is
It's not paving, that's why I was like, what?
No, but there's no utilities or
if
anything.
there's no utilities, we
You
can
can't even-
have
you
one
can't
year.
even-
That's if they don't run that Con Ed.
Oh, right. I'm sorry, I forgot so quickly.
It's 6
It
blocks.
was the top bid.
Yeah.
Right, Con Ed is the culprit. All right, so if that's it, that's it?
I think that's it.
Wow, thank you.
Okay,
Thank you.
Thank you again.
Thank you. Next time we'll have you go first. Yeah, we're sorry.
Yeah,
that
we
was a little
understood
mixed up.
the nature of Corona.
Yeah.
Bring pictures.
Did you get some information?
Bring pictures.
Yes, I did.
Good.
You know,
Yeah.
I did.
Good.
And as always, I'll email you this.
Yes.
Nobody wants to get sick.
You know, they've been sold out on those masks, and I've been told that those masks do absolutely nothing.
Yeah.
Well, the cheap ones do nothing, don't do nothing. It's the other ones that have,
You mean the ones with canisters?
yes, and then there's
But the
another
ones
one.
with the canisters, you have to be professional.
No, but there's ones in between the ones with the canisters and the super cheap ones, because when I was not in China, but when I was over in Asia, and there was one place I was where the smog was so bad that they were recommending that people for about a week wear them, and they were telling me which ones to get. There's something between the cheap ones and the canisters.
And
did you get it?
And then N95, like.
I think they're all selling now, like Amazon.
Did you get it?
Yeah,
barrier.
so
Someone sneezes on you, it's
well,
better
it
than
was just
nothing.
the smog in Bangkok for a couple of days. There was a real smog alert, so a lot of people wearing it. But this was not recently.
All right, so we want to get out of here, so there are a couple of things. Young ladies, hi, are you here for a specific issue, or you're just here for the meeting?
We're from the elected office.
The elected. Oh, I didn't know, okay, hi.
Senator Kavanaugh, you said?
Yes. Okay.
Oh, can you have the senator help us with the letter to Con Edison to
Yeah.
speed this up?
Oh, let me get you a pen.
Speak with Diana.
Okay, that'd be
Okay,
great.
great.
Thank you. Okay.
And also then we might as well ask Cora, if Cora can get Margaret to help sign on to the.
That would be good, because it's state.
Yeah, Cora, the public, public works.
So, couple of things,
They want
oh,
Margaret to sign up. Tell
No, that
Cora.
was my fault. I was asking Cora. a
Yeah,
question.
sign on to.
Oh,
sign
I'm
on
sorry.
to.
The Con Edison
The
letter.
letter we're writing.
Are we doing a letter, or are we doing a
He
resolution?
said,
Yeah.
Kavanaugh,
A
should
letter
Kavanaugh
or
do a
resolution?
letter also to non.
Bob, I was distracted.
I
I thought we were doing a letter for
Started
now.
with letter, then it seemed like there was a whole bunch of
We had a little
stuff.
discussion
Maybe
about
we just
Rezo.
reso
Rezo.
instead, because it's Mark, and call on, the state department, the regulatory
Yeah,
agency.
they'll.
It's so hot. I don't know. Cora and Mark?
Yeah.
Mark. Are we doing a letter, or are we doing a reso?
There's so much stuff here, I don't know.
Well, shall we just do a letter to
Yeah.
start, and then if we can't get any satisfaction, do a reso?
I would
Alright.
recommend we do a letter for now. We can
Yeah.
turn that around faster.
Yeah.
And I'll work on it in Lucian's absence.
Yeah.
If it continues to be a problem, we could do a resolution
Next
aimed at the
month.
higher ups for
Right.
the broader issues.
That makes sense.
Cool. Okay, that sounds good.
But
So-
it should be, we strongly urge kind of thing, words, you know.
Demand.
Not pretty please, it can't be pretty please anymore.
I will use my heart.
Not demand, we're at the demand stage
And,
yet.
and, you know, maybe you can throw in some of those things about, you know, the fact that it's, that quality of life is being impacted
of
for the
course.
residents, and they've already lived in it,
And
but
this
they
could
live
have
in
been
an
done in
area
3
with constant
years.
construction and blah, blah, blah. I know she got it, she got
Yeah,
it.
she knows.
So, Jill, next month you're gonna talk to us about,
Yes, housing, affordable housing,
affordable, which doesn't exist.
which
but
doesn't
okay.
exist.
Yes. But, so we're gonna put you on the,
Yes.
schedule
Yes.
for affordable? Okay, and,
Is there a way for me to reach out or get the email addresses from the former task force members, in case they'd like to come to this?
oh, you mean you don't have them?
I have them through Tom, I could go through Tom's stuff, but.
No, I mean, we could probably find
All right, let
them.
me
I don't
see.
know that, I don't, because,
I'll see what I can find.
yeah, because
All right, and
Lucian
I'll go
wasn't
through it.
here when that was active.
You
So
know
we'll see if we can
who's
find them.
I know personally, but if I have a
I
problem.
mean, we can reach out to Jeff Ehrlich, who was on the town, and Diane, you on the town?
Diane,
So,
yes.
so maybe you can come up with some of the names and compile a
Pat, a
list.
suggestion might be at the full board meeting at the end of the month, maybe make an announcement for the people that were on the task force.
Would you
And who would
remind,
like to, I would.
would
love to
you
do
remind
that.
me, because
Yes.
my brain, I know you all know
That's
I'm
a good
dealing with
idea.
my mother, so my brain's not gonna remember, so remind me of that, okay?
Yes.
Then I want to ask that we do something about Alzheimer's. That we get somebody in here, because evidently it's 2/3 of the patients are women, and it is on the rise. And I think that we might want to have a forum and invite the
gonna actually-
community.
For now, too.
Could
We
you
had
include
that, we
dimension
had
with
that
Pat?
health,
I can help.
expo, whatever we had. Wasn't there someone here about expert in Alzheimer's
I don't remember that anyone was here for about.
last year?
We had people who were here that deal with
I thought
seniors,
there was
but I don't know
somebody.
that we had.
Yeah, but I
anyone
thought there was
specific.
mention, maybe I forget.
Okay, so Cora is volunteering.
I can help connect you with Caring Kind, which deals with Alzheimer's.
Okay,
And
and
they
there's the
have been-
Alzheimer's organization.
It's renamed.
Mhm.
It's renamed Caring Kind instead of saying Alzheimer's.
No, but I thought there was an
Foundation.
I thought
Yes,
there was,
there are.
what's your name, Maria
Is
Schreiber.
Alzheimer's offensive
There are.
now? Is that not?
It,
Or are they
it
encompassing
all
more?
depends. It just everyone is different,
Okay, but Maria
So,
Schreiber has an
like,
organization.
But she seemed to
like
think
the
it was willing to-
organization.
But I don't think it's the
Karen
same, I don't think it's the
Oh.
same one.
Just respond to your question about whether or not it's offensive. Just like there's an organization who used to deal with, help people with women, domestic violence. Now it's called Womenkind.
Oh, okay.
So it's not
But
like,
it's not very descriptive.
okay, you know? So
I mean, it doesn't
sometimes
really
people-
tell people what they
and
need.
They offer support service to family
I wouldn't worry about it,
members.
it's just, yeah,
Me
either way.
neither. The-
Okay,
Pat,
so
can I just
listen.
ask you,
That's one
could
of
you
those
add one
things that
thing?
we- the
Can you
meat of the
please
problem is
add
more
dementia
important than the name.
with, like,
Yeah.
group that?
Oh, that's part of it, that's part of
Okay,
it,
good.
it's
When you say-
all together.
Okay.
And you know, you and I wanna know, I mean, I wanna know because I'm dealing with
Yeah,
my
because
mother.
that's all one.
So you may appreciate that presentation and the tons
Okay.
of resources.
Now let me,
available.
you're gonna help. Now let's try to organize our committee a little differently. Can we get everybody kind of going online and looking up? You don't have to spend a lot of time, but can we kind of go online and look a little bit around and see if you can come back with a little bit of information or organization that we can reach out to, get a representative? We don't have to do this for next month. We can plan this meeting for a few months from now.
What about contacting somebody from AARP? They usually have a good representative.
Then do
Yeah.
it. I mean,
They
just
can't,
get a
now, they
little
did
bit-
come in before, but I wouldn't mind seeing
It
them
was,
again.
it was
They were
about
good.
something else.
Yeah.
They came in
You
about
don't have
something
to
else.
contact them, I'm just saying, go online and look a little bit and see, if we all
No,
kind of
we have
pitch
a
in and get a
contact.
little bit
That's
of.
my
Okay, so
suggestion.
we have somebody for AARP.
Okay,
Then that way Diana and Lucia don't have to do all of the work, if we can do a little bit of the work, like bring to them organizations that we would like to
I think there's
invite.
an organization called The Place for Mom. They advertise on
Yeah.
on
So, I
TV
mean,
and
just
the
do
newspaper.
a
also.
little bit of looking around. You don't have to put a lot of time into it. I'm really seriously, like 15 minutes, 20 minutes. Don't put a lot of time into it, okay? But it would be nice to do a forum because I think this is something that, a lot of times we do forums and, not a lot of times, but the few forums that we've had, like the most successful one I think was the one with buildings, Department of Buildings. When we did the one where we had,
Construction forum.
the construction forum was successful, right. But the one where we had, no,
Yeah.
Staying alive, what is it?
CPR.
CPR, thank you. Thank you, the health one, we didn't have that many people come. You know about staying alive, you're supposed to pump according to that song. So, let's see, maybe we can get this one, because I think it affects a lot of people. It doesn't care how rich you are, it doesn't care how poor you are, it doesn't care color, but it does care if you're a woman.
About a couple of years ago, when we had that, I think what Mark was alluding to, the health forum, Gail, the borough president, was heavily involved with that. So this might be
Maybe
something.
that's what I'm remembering. I can't remember.
What?
Maybe that's what I'm remembering.
Yeah,
Yeah.
because I kind of, like, I helped with that thing, and I remember that she put her office's resources really a lot for that, so maybe this is something that,
Well, like I
you
said,
guys.
it doesn't have to be for next month. So
No, but
let's
just to
think
mention it to her,
terms. Yes,
because I
we
think
will.
that she is interested in that type of stuff.
Right, yeah. And I think it's really important, because as I say, and the thing that, the story that I was watching about it today said that people think that it is a disease that you should start to deal with as you get, like, in your 60s and you get older, and
It
the
might be too late
information
then,
is that it's too late then. You're supposed to start dealing with it in your 30s. It's about sleep and eating well and exercise, and you have to start dealing with it earlier to try. And it's also, everyone thinks that Alzheimer's is hereditary. It is. I mean, yes, you're more likely to get it if someone in your family has it, but you don't have to
You
have
don't have to
anybody in
get
your family, and you can still get it.
But one of the other things I just want to bring up, unless you qualify for Medicaid, unfortunately in this country, any of the other insurances, unless you buy long-term insurance,
Right.
doesn't take care of
Right.
these mental dementia and Alzheimer's for
Exactly.
long-term, because it only gives you 100 days,
Right.
and if you have Alzheimer's,
Right.
it's a lot
You
more than
can live
100
a long
days.
time.
That's Medicaid
Are the
or
Great
Medicare?
Panthers?
Medicaid will take care of that. If you don't qualify for Medicaid, and the threshold for Medicaid is super low,
Yeah, of course.
it's ridiculous. It's like 1920
You have to
like
defeat
levels.
yourself of all
And so Medicare, you could have the best insurance, you could have from the Army insurance, you could have the best insurance in the world. You could have been in the military for 50 years, and they don't cover long-term.
So that could be something maybe that we could look into
Right.
too, and work
I was
on a
gonna say,
resolution
does anybody
asking
know if
for
the
like
Great
the federal.
Panthers are around? Because the Great Panthers, if they could send, you know who they are?
Yes, that senior group.
Yes,
Yeah.
the senior group,
Yeah.
and they're very active with all kinds of senior issues, and we should see if they still exist and if they have representation in New York and try to get
But
them
we
in.
could bring maybe also Hannah from Nadler's office,
Yes,
if
yes.
there's a federal issue, something like
That's what I'm
Medicaid.
saying. Everybody, let's compile a
These
list.
are definitely federal issues, like for the treatment side of
Okay,
it.
let's not discuss it now.
Or
So
state
we're gonna-
issues,
we're
state
gonna start-
Medicaid.
We can't have a discussion online, but what we can do online is we can start a list. So you can put Medicaid on there, and I can
No,
put Great
it's not
Panthers.
Medicaid, it's Medicare.
Whatever it is, we'll put on there, and everybody could put a list, everybody could put an item on to contribute to the forum, and we will then try to investigate and get the right representation in, and let the community know, and try to get a large enough space for the community to come in and
So we can discuss ideas for preparing for a meeting as opposed to things that would, that are substantive resolution items. So we're just preparing for the meeting kind of thing. So you don't want to get trapped into a discussion of what's good, what's not good. Just what should be added for us to discuss in the meeting that we're going to set
You understand
up.
what Margaret's saying?
That
So-
way we don't
right.
fall under the open meetings law.
Right.
That we're just preparing for the meeting.
Oh,
We're
it
not
can't
dis-
be like we're having a
Right,
meeting.
right, am I
online.
saying it
have a
right?
meeting.
Yeah,
Online,
yeah,
right.
We
right,
can't
okay.
discuss
Right, yeah.
in-depth issues
Right.
online, because we have to be open to the public.
Yeah.
But we can put a list together where everyone contributes something, and we just have a list, so that we then will start to work from that list on, we wanna invite someone from this organization, someone from that
You can
organization.
prepare for the meeting.
But exactly what
Organize.
that's what I said.
Exactly.
Prepares.
Exactly. Okay, so now, next month, we're gonna do affordable housing with Jill, right? What else do we want to put on the agenda for
Was
next
the
month?
guys? I had on my calendar the people from the nightlife.
They're supposed to
City.
come, but
We'll
they.
move them again?
Did
to
they?
next month?
Yeah, because they didn't,
They canceled or they didn't.
They can't,
They didn't respond.
yeah.
So I guess them again.
So we're gonna try for the nightlife
Okay.
people again, right?
And could we ask?
What's next month?
March?
March, yeah.
Right.
Can we ask Lucian again, because I know he was away, to follow up with the representative from 11 Hubert about the new construction that's going to happen there? He
Well,
promised
yeah,
to
that,
come.
well, that he had moved to transportation, and I don't think I don't think they did it.
No. This is a different issue. This is the construction of the building,
Oh, okay.
the renovation of the building, not the
Okay.
lighting. This is completely different.
Okay.
Can you
Yeah,
just shoot us a quick email?
Yeah,
Okay,
yeah,
to
and
remind us? Any
see if you can get in contact so you can come to see. So,
Any other
yeah,
issue that anybody wants to put on the agenda?
Anybody want to have lunch in Chinatown with me?
I'd love to.
Okay.
I'd love to.
Next
Well,
week.
I have a resolution also.
Oh, that's right, you have a resolution. We're done with this part of the meeting then? Nothing else that we want
We
to
have
put
large
on
venue.
for
You're gonna go on that?
March?
Large
Well,
venue.
when large venue update?
You can do
Wanna
that.
do
But
that?
that's up to you.
Oh.
Is there anybody here that doesn't know about what's going on with large venues? Everybody knows something? Yes?
Everybody knows the outcome of our vote the other day?
No.
We
Oh.
rejected the license for 18 William, otherwise known as
20 exchange.
20 Exchange, yes.
But what does that mean?
It means that they potentially, or at least according to them, there's a lot of confusion, but what they have been saying to the community is that they have the as of right, the permission, the legal authority to go forward with some sort of venue for 3,500 people, with or without the liquor license. That is debatable because they're counting spaces like the bathroom and the kitchen, the closets as part of the 35, the capacity. And also using that as a means around obtaining a cabaret license, because they discussed bringing 500 people in, and so we asked the question of whether or not that included their employees, and they went on to say no, there's 150 employees also, and so I noted that after 600 people and up, in that kind of entertainment venue, a cabaret license is required. And they said, oh, we were gonna get one, but now we're not going to because we're using all our space. But you're not gonna be doing a show in the bathroom, so I don't know how they're using all their space. It doesn't really make sense to me.
One of the other, I'm sorry.
Right. Go ahead.
One of the other issues also is that we asked them if they're bringing down, even if it's 500 people. You know that it's 500 people per show every single day, 365 days a year, and twice on Saturday and twice on Sunday. So it'd be 1,000 people on Saturday, 1,000 people on Sunday. But the point is, we asked them if they were in communication with Cipriani, because we all know Cipriani is a large venue and that we already have traffic issues because of Cipriani. They said they kind of said they were in contact, but we wanted to know, so if Cipriani has a large event and you have these 500 people, how are you gonna manage?
They're
Oh, by
not
the
gonna
way,
coordinate.
wait, by the way, they said to us that they anticipate only 77 cars per event. 77 cars arriving to drop off passengers, and 77 cars possibly picking passengers up to take them out of the
They
airport.
started at
They're clown
24.
cars, they're clown cars, so they're gonna
Yeah,
have like
but
100 people.
we
each
laughed.
car, yeah.
And the residents
Pat,
that
they're
were
not
in
gonna coordinate with
attendance
Cipriani's, because the Cipriani's has a $100,000 private event on a day that there's a show, that's
Yeah, but we had to ask, we had to
Yeah,
ask.
you know,
And then the other thing that we asked is, so have you discussed all of this with the fire department, the EMS, the police? And their response was basically no.
not yet.
And that they were waiting to hear the results of the meeting from last night, was it last night? It was from last night. They were waiting to hear
Tuesday.
the results of last night. In other words, waiting to hear whether we
So
were gonna grant them.
if they have to ask the fire department or the police department about 3,500 people,
Right.
or about 500 people, which
Because
is
they're
also
holding
ridiculous.
the larger amount of people kind of over the neighborhood's head is kind of like they were.
But the neighborhood is so against it,
Yeah.
so much in opposite, they're willing to take the risk that,
Well,
we'll
that's
take
what I
our
was gonna say.
chances. We'll
But
roll
tell
the
them what
dice
that
on
means.
this, because we don't want it in our neighborhood, period.
No, but
That was
tell
what
them
the,
what that means. Just-
rolling the dice means that the community is gonna have to, they understand this, they claim to understand, they're gonna have to go to Albany, they're gonna have to continue to fight, they're gonna have to go to the SLA, all the hearings and everything, because they are really dead set against it, so they were not willing to negotiate and allow for any stipulations, and really, neither was the committee, because that's why we rejected it outright. Like 99.9% of the time, we approve a person, an entity's license with stipulations. There were no stipulations to which we could come, because for the reasons that, Pat and I already talked about, but also things like I asked them, when they did their engineering study of the traffic, like what had been the capacity of, the number of people or cars or whatever, upon the infrastructure that the infrastructure could withstand, and the environment can withstand it. Oh, we didn't look at that. Like anything that's a good question, but we didn't do that.
Right.
And I'm like,
Yeah, the traffic study was completely
yeah,
inadequate.
Susan blasted them for
You
being
didn't like the
inadequate.
77 cars?
How about-
But even if we could have worked out like stipulations for them, like we do at every other bar, time of hours, you only have one event a night, you won't have events on Christmas and Hanukkah and this and that. Even we could have worked all those stipulations out. The traffic plan was the thing that main reason why we couldn't approve it. And like was said, and they have this grandiose idea that they're going to social engineer people paying $200 for a ticket and $20 for
That
a
was
beer,
the terminology
that
they
they're
used.
not going to use Ubers, that they're going to make sure that they somehow incentivize them to use subways, and it's not going to happen. So their projections of 53 Uber types and whatever the difference is of personal cars to an event that has 500 people was just not realistic.
Right,
So
and those
that
give people
alone,
PIN numbers,
yeah.
like, basically validating their Uber to stop at Water Street and Wall instead of in front of the
But that's a
event hall.
convincing factor as far as the SLA goes with regards to not telling them that it's not in the public interest to do this, as opposed to, well, we don't want a big venue in my backyard type of argument. Because that's reality, and then it affects
Mark,
emergency
explain
vehicles,
to
all that
everybody
stuff.
though, that just because we rejected it,
Yeah.
go ahead.
Well, the thing with, the way we'll write, basically the resolution will be written is that we're rejecting it because of all the reasons that were discussed, and others that we didn't discuss here. And the traffic thing will be a big issue. It's just it can't sustain this venue can't sustain it, and that and we like you said, we passed 99% of resolutions applications with stipulations. So it'll be written in a way where it would be like the thing is, everyone thinks that if you outright reject it, then they can get whatever they want. That's not necessarily true, because you can put in the resolution that that these are our concerns, and the SLA will take that into account. So in their initial application to us, they said they want to close at midnight on the weekends. So it's still in there,
They want it
so.
to be open till 3 a.m.
Yeah,
They
yeah.
want it to open at 6 a.m., operate a cafe from 6 a.m. to 6 p.m., then
Right.
close the cafe and open the shows from 6
the 6
p.m. to
bars.
3 a.m.
But what they presented to us
That was the
on the
original.
night on Tuesday
This was from
night,
yesterday.
it was midnight.
Right.
So that will be included in the resolution. We're saying, well, just because they rejected you, now you want 3 a.m. So the SLA kind of won't go for that kind of thing. So,
So we'll see. At this point, we'll have to vote, all of us will have to vote on it at the full board meeting, and then we'll see.
I was
and there were about 80 residents there.
I always thought this was kind of deep down, a number of levels into the.
Oh, it was 7
ground.
floors.
That
Yeah.
was who
always
was
seemed to
in
me
here.
as though
There
there's
were
a
people in the
an
hallway.
emergency
There
happening.
were people turned away because it was a fire hazard. They were told
Right.
they could not attend the meeting.
Right.
There was
It's too
streaming. It was
incredible.
live
But you're
streaming on Facebook. There were like 400 or 500
But he's
people.
talking about the venue. And the venue, yes, is in a basement, but and we're not worried about noise coming from.
I'm not worried
inside
about
the
noise,
venue.
I'm talking about emergencies.
Well, that's what we talked
That-
about.
right.
And then the
That was one of the issues. A fire
second,
hazard.
third, and fourth floor would be the performers. The performers, the way they explained it to us, would interact with the patrons. And one thing we discovered,
And
one
give
of
them liquor?
one of the
Yeah.
people that were here said, well, when I went to the one that you had on
No,
27th Street,
no.
one of the dancers gave me a shot. And the owner was like, no, that didn't happen first.
said it was sugar
right?
water.
Then I like that caught me right away. It was a red flag for me. So we had to pull it out of him like pulling teeth. Then finally he says, oh well, they probably gave him a shot of sugar water, and everybody laughed like that's. And then it turns out today that we see some of the reviews online.
Publicly published
And they say,
documentation
and the
they
patrons
give
are
out
saying,
shots
well,
to naked
the
people.
dancers gave a shot of whiskey.
I mean, from naked people. The performers are naked and giving them liquor.
I didn't
Give
hear the
shots of
performers
whiskey.
were naked.
That's what was in that document that we got
So
today.
that's another thing.
What do you want for $200?
That's another thing the SLA doesn't like was when the applicant lies to the community board about a specific question. So
I still would focus on the
I don't know
traffic.
about that either.
I'll send it to you.
Mariana, I still would focus on the traffic.
Oh, yeah.
And-
No.
because
Our
The other
issue,
stuff
yeah.
that goes on inside, like they
Well,
can.
that's a problem too. That is problematic. People being
but
naked and giving, and, you know,
Right, but
and
what- if they come-
exchanging liquor with people that they talked about how they don't necessarily check the IDs. They do
Right.
some checking out front. They're not going to do any
But
more
what goes
queuing
on
in the
is-
back. So that's a quality of life issue as well.
As they
But I
come
agree
out.
with you. That's not on what we're focused. We're
Right.
focused on the traffic and the
Right.
public safety
garbage.
and the
Because that-
garbage
that-
and the noise.
Right.
And an ambulance to get
Because
down
then
the street.
you get into a slippery slope, but it's the
Right,
stuff
right. We've
outside.
already- we've done it.
But that is a problem though. And
So-
even Anthony said we should include it.
Okay.
All right, so now we've discussed this, you kind of have an idea, so Tuesday when it comes up, you kind of have an idea, and you're going to have a lot of residents that will show up to let you know that there are like
They are
2,000
not happy.
residents who are opposed to it, okay?
They do have, whether it was, how it was obtained is in question, but they do have 400 signatures also of residents supporting it. But as I understand it, there's a 2,000 petition, against it. And a couple of organizations, and these buildings have united, there's like 15 Broad and 3 Hanover and 20 Exchange, 55 Water, presidents of all the buildings, coming together
building that
to
is
work
taking
together
place
to oppose it.
Mariana, could you just tell the people that weren't there yesterday, one of the biggest red flags, I think, for all of us, the organization had a petition that was signed in support of them, and by the condo board of 15
They brought
William Street.
a letter from 15
and
William,
where
yeah.
it said signature, under the president of the condo board, the person wrote the president of the condo board.
No,
They
no,
didn't-
no, just the condo board.
Board of Managers,
Oh, you're right,
no
right, that's what it
printed
was.
name,
No name.
they signed their name, Board of Managers,
right,
which is,
so that was a
obviously
big
that's
red flag
ridiculous.
for us.
And then they had some other person, there was some, it's FIDI nonprofit, Keep FIDI Safe nonprofit was the other name that they, typed out, and then somebody's signature that you couldn't read. It didn't say what if they were the chair, the secretary, or who they were for this supposed nonprofit, which is, a nonprofit has to have a board of directors. You can't just do it like that.
conviction.
No real name.
So that was bogus.
All right, so we
The
wanna get out
story
of here.
behind that is that one building, 15 William Street, made a side deal with the venue.
Except
And
the all of them
right.
didn't know about
Right,
it.
right, yeah, so there were 3 residents
Right, there were
down at the
residents
building
from
that
there
said
that
no
were
one
like, we
told
don't
us
know
about
about
it,
that.
so.
They didn't know a thing about it.
So it's a little
But
dubious.
the side deal even was
Mm,
that we're not necessarily for you, but we're not going to oppose you,
Right, yeah.
was the agreement.
They were
Very
worried about
bizarre.
the gamble, they were worried about the all or nothing thing,
Yeah.
which I had some reservations
It was,
too, because the gambling
Well,
thing
we all
could,
do.
yeah.
We all do, but the community is ready for the fight. They claim to be ready for the fight. They're getting a lawyer. They're doing whatever they have to do. So
They better get a lawyer.
we'll see what happens.
All right, so we need to move on. So glad you've been filled in. And no other topics for Mimi. No, you know, think about in future if you have a topic you want to bring to put on the agenda, please do. Okay, so what else? Oh, you have a.
So I have last month we did a resolution and the 9/11 related resolution. So I just have like a supporting one for that, just to be in tandem. I forgot to print it out. So whereas on July 29, 2019, the Never Forget the Heroes, James Zadroga, Ray Pfeiffer, and Luis Alvarez permanent authorization of the September 11th Victims Compensation Fund Act became law, making the Victim Compensation Fund, or VCF, permanent through 2090, and restoring cuts to claimants' awards made in 2019, and whereas 9/11 survivors and responders will thus be able to file compensation claims for their current 9/11 related physical illnesses or for illnesses that manifest in the future. And whereas the VCF strongly encourages residents and other survivors who were present in the 9/11 exposure zone, Lower Manhattan below Canal Street, to register on the VCF website as soon as possible, whether or not they have been diagnosed with a 9/11 related illness. And whereas the VCF has recently announced a revised policy to enable claimants who missed prior VCF registration deadlines and had been notified that their claims were ineligible, that they are now have a grace period out of 2 years to register, with a new deadline of July 29, 2021. Whereas many survivors remain confused about the VCF claim deadlines and requirements, and whereas the VCF has established documentation requirements for survivors to show their presence in the exposure zone, that with the passage of time may become more difficult to meet as documentation is destroyed or becomes harder to obtain. Therefore, be it resolved that CB1 applauds the VCF's revised policy, which will enable claims of many otherwise eligible claimants which have been deemed ineligible due to lack of timely registration to move forward immediately. And be it further resolved that CB1 will continue to be in dialogue with the VCF with respect to what steps can be taken to ensure that residents and other eligible survivors are more fully informed about the VCF. And be it further resolved that CB1 calls on the VCF to create clear, accessible messaging and materials aimed at informing survivors about the VCF, its deadlines and requirements. Be it further resolved that CB1 calls on the relevant public officials for assistance in approaching the Internal Revenue Services in order to streamline and process for survivors to obtain tax returns for the years 2001 and 2002 to use as documentation of presence for their VCF claims.
So you're gonna bring it up
I have
in
one
new
question,
business,
yeah.
right, at the full board?
I think that's really agree 100%. And this is an issue I think we've both brought up, that for our kids, the next generation, and you touch on that, being able to prove residency is going to be harder and harder. So the kids aren't going to be able to get their parents' tax returns because it's not theirs. Does it make sense? Is it something to think about to add to the reso?
That's what I was asking.
That they, because I did ask them here, so if, you know, the kids, whatever, the next generation, you know, they apply, even though they're not sick, can they upload their residency and have that approved? It's accepted as a resident now,
Right.
God willing, they'll never need it. And they said, no, they can upload it, but they won't let them know if it's approved as residency until they need it.
Which is the fetus.
So then if it's 30 years from now,
Right, that's the fetus. That's why I was saying we're going to definitely have some more resolutions because there's a lot of stuff
so
that we.
add to the reso, or you're going to make a separate one that VCF approves the residency based on, we'll review the residency materials now.
You're making a friendly amendment.
Based on the registration.
Right, just based on the
Right.
registration.
Based
which is-
on-
No, that they should make a determination on the residency based on the registration.
Yeah.
And that it not be delayed to, at the point when there's a claim.
Right,
And
because even if they upload it now, if
Wait,
it's
give her language.
I just said it,
Actual language.
Make a determination of the residency
at the point of
But you
registration.
said residency of
at the
minors or something.
No, not by anybody, because
Anybody.
how about people that
You
didn't
can't
file
tell.
taxes in 2000 or 2001? That shouldn't preclude them from the benefits.
Determination should not be,
Right.
delayed,
That's just a tool.
should not be, what did I say before? Should not be delayed, when there's a claim.
I mean,
Doesn't
you
sound
could-
100%
you
right,
guys
but
could also
you can
go on-
wordsmith that a little better, yeah.
You could go on email and do that
Yeah,
too.
so,
Yeah, and then
Okay.
we want to add the, even though it is, yes, 100% for everyone, say this is a particular need for the next
That's up to
generation.
you.
Right. And-
Yeah, we could say that.
Mariana, when
It-
you're talking about the tax thing, if you could just say, but this is not a determining factor, this is just one of many factors, because I don't want them, well, we can't get your taxes, so, you
Just give
know,
it language though.
I'll leave that to some,
Yeah, but it's your idea, so you have to let her know.
Mark, give a good language.
say it again? What is it?
That, one of the things that was written there, which is wonderful, is that the IRS would provide these things, but that's the determining factor, because there are people that didn't file taxes for whether they made too
But
little.
wait, you mean that's not the determining
That's not the
factor,
only-
whether they have, whether
Whether
they
they
decided?
qualify.
Right.
Okay.
So we could say that this is
Oh,
not.
that tax return should
Not be
should
the
not be
only-
the
It's not the only-
sole determinant
Right.
factor of
Or if you have
eligibility.
no tax
yeah.
returns, it should not disqualify
Don't muddy
you.
the waters now, you had a good line.
That-
You
Yeah,
had a good-
that- so that tax returns is one of many factors, but
Thank
it
you.
should not be
Right.
the sole,
what I meant to
the
say.
sole factor of
Right.
determining eligibility.
Right. Or residency.
Eligibility for residents.
Residency.
We mentioned that one because we had, at the other meeting, we
Right.
had Congressman Nadler's office here.
Right.
So they made clear that that was something that they could do, was be in touch with any other federal agencies
Right.
and try to navigate.
Yeah,
that for us.
that's a good tool,
Yeah, yeah.
but that shouldn't, if you
No, I
don't
agree
have
with
that,
you.
you
I'm
shouldn't.
just saying that's how the IRS thing came up
Right. Do we need
specifically.
to vote on it?
We
No,
should-
it's not on the
we-
agenda, so bring it up right,
Is-
at new business.
Or is it old business for us?
Old or new at the full board.
No, I mean, is it old business for quality of life?
I suppose you could do that.
This is, we've discussed it,
Yeah.
this is all
Because
business.
you had,
We had one last month,
Yeah.
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 Do we need to vote on it?
that's what we're trying to decide. Do
we have
we
to
have to vote on it?
I
It
voted
might be,
Not
s-
a parliamentarian.
it might be safer to just bring it up
Michael?
at
Do
the,
you have a thought on
I
that,
mean, it could be
Michael?
both, one or the other, I mean,
I don't have a problem
Yeah.
with you doing the resolution now.
yeah.
Okay.
You know, if it's thought later that
Is there a
we
quorum?
can treat it like new
There is a
business,
quorum.
Yeah,
So
Okay.
if we vote on it now, and then it's rejected by that we shouldn't have, that it should be new business, that's not a problem, right?
it would just be
I don't think there's a
shuffled around on the
controversial,
agenda. But that's
I think
another thing
everybody will be
too,
in favor of it.
because I've always asked that on these agendas, it always say old and new business, so at least we have it covered.
Oh, yeah.
You know, you can do old new business in a committee,
Next time
but,
we'll
yeah,
have
so,
to.
yeah. But
Okay.
every agenda should have that.
So everyone in favor as written with the amendments? Or
What was it,
no,
public, yeah.
Board, committee members first, any rejections of committee members? Public members in favor, public members against? Okay, so it's unanimous.
Okay.
All right, so that will be on the agenda
Thanks.
for the full board as well as the large venues. Again, just keep thinking about the Alzheimer's, let's do a forum, let's try to get it maybe
Which you remember
done in
when
3
you
months.
do the agenda, you put it as
Yeah,
an
when you
old
talk about
business
the
item.
form, I know
on
you
the
said it's part of it,
board
but I would
agenda.
include
So
the
they-
dementia
so
slash
they-
Alzheimer's.
so they know.
Put it on the list. We're gonna start circulating a
I'm
list.
telling you that now.
I will
Like maybe
remember, I will
old
remember.
business.
Put it on the list.
I'm gonna write it
Call it
down.
like,
Remember it.
not-
I'll be like, what is this?
Okay, thanks everybody.
We
I
could
bet
start
you-
email.
I have
Yeah,
a possible.
Oh, wait.
like here, it would be
Wait.
like, it would be like,
Francis has
a
it would
thought,
be, this
a
is the items,
possible
1, 2, 3, and then you'd have
proposal.
like old,
I know
And then item one,
we're
like
on
that.
the cusp of,
Okay.
like,
of Chinatown, but I was
category.
wondering if,
of quality.
you know, we would want
You
to
must be a
consider
doctor.
asking Margaret if we could have a March board meeting in Chinatown to show our support.
if she could get us a little, how would people feel about that?
No MSG.
I wouldn't mind.
No MSG.
Nah. How do people feel?
Vegetarian.
Yeah? Would it bother
Even
anybody?
use
Not necessarily a food, you know, just a location for us to have.
anymore, do they?
What's in our
It's
area?
just-
Oh, maybe at
someplace
Bircham?
more-
Maybe there, or maybe does Chatham have a, community room or something? And that would be within our board.
Well, we'll let you
Well,
figure it out.
You thought you
I'm gonna
wanted
ask about
a
Mohawk
restaurant
now,
place,
Tuesday.
not a convenience.
They
No, no,
definitely-
To hold the community board
Board
meeting,
meeting.
to hold the full board meeting for March.
No, just the.
Unless do you have a locale already?
I think there probably is, but Lucian does that, so I'll have to check.
So
with
March
him
or
for
April,
full
then
board.
maybe April, yeah. All right, so let's see.
Oh, so people are okay with that?
Great
I
idea.
think that
Yeah.
we should show us.
Just a joke, everybody come in wearing the masks.
But don't forget,
just a joke.
don't
Don't be like
forget,
Bloomberg.
isn't it March
Nice.
1st that we
Just a
have to
joke.
start using reusable bags?
I
Yes.
prefaced it by
So
saying
there's
just a
some down
joke.
there, there's some down there, hi. And you, are you just coming to visit us, or?
I applied, you just had the deadline for applications for the board.
Don't you love the Quality of Life Committee? Wouldn't you want
Look
to
at
be a
him,
public
he's
member?
still here, he's still here.
So, keep coming.
Yeah, I wanted
Keep
to
coming. Did you sign in?
I sent it all over.
Make sure you sign in and keep
The
coming to
list
Quality
is
of
right
Life.
there.
People wearing.
And also, if you
Sir,
have,
right there by the,
let's see by the bag.
Thank you.
And if you have
They do have
suggestions
colors
for
in it.
agenda items, let us know.
Okay, thank you.
Yeah.
It's not a stigma over there.
That way you'll feel more engaged and you'll want to
It's
come
just a
back.
stigma over
Into
there.
it, it was
Okay.
impressive.
Good. What is your name?
Ben,
Ben. Hi, Ben. I'm Pat.
Oh, I forgot to ask you about that.
This is everybody. Who
Ben,
are you?
everybody. Last name.
Hi,
Mariama.
Pat.
I'm
Hi. Hi, Ben.
Mariama, nice to meet you.
Francis.
Oh, no, so we're all, hey, Ben.
Bob, Jill, Michael. Yeah, sure. Mitch, Mimi, Mark.
As a matter of fact, no.
You won't remember the names.
Oh, yeah, you
I was gonna,
Let's do it alphabetical.
We self-organized.
Do it alphabetical.
Rise up and stuff, okay?